So, why is now a good time to pursue an MHSA degree? Well, as Dr. Gollu will share in a few minutes, he has an extensive background in health systems and in economics. And his research is really focused on the intersection of health policy and health economics. And so he brings not only experience in these areas, but then some previous programmatic leadership as well. And in our program, in addition to leading the program strategic planning, he teaches in population health and data visualization. And then he advises first and second year students in terms of career planning and progress. So, without too much more from me for now, I'm going to pass it over to Dr. Galu, and he's going to share his screen with us and kick us off here.
Hello, everyone. Thank you, AJ, for the introduction. I hope all is well, and thanks for being with us today. I hope you can find answers to your questions today. We have student representatives, we have our Associate Director, AJ, and I'll be here, but please don't feel like this is the only opportunity. We'll provide our contact information, and you can reach to us after this information session too. So let's talk about why it is an interesting time to be a healthcare leader. So let me show you this graph. Have you seen this one before? I don't see many faces, but I see Ethan and Haider. Haider, is that correct? Excellent. So this is actually showing us the healthcare expenditures per capita among different countries. These are the developed ones only. So this is showing United States is actually spending the most healthcare per capita in US dollars compared to other developed countries. And we are actually a major outlier in this. The runner-up is Switzerland, but spending 40% less than United States per capita. And the average of all the developed OECD countries is around half of what US is spending for per person in healthcare dollars. This is massive, and we are spending a lot of money. So if you check out the trends, actually the picture becomes a little bit more sobering. Here you see the healthcare spending per person trend for United States and comparable countries, OECD member countries over time. So this is the trend starting from the year 2000. And this gap is actually widening. And over time, the healthcare spending we do per person is actually growing faster than other OECD member countries and faster than the inflation, actually. So we are spending more and more, and the gap with other developed nations keeps growing. So the obvious question is, does that translate into better health outcomes? So do we get better health? Unfortunately, the answer is no. When you look at international comparisons, the United States actually sits at the bottom. Americans have shorter life expectancy and more avoidable deaths than peer countries. In other words, we spend the most, but don't get the best outcomes. So if you actually compare US to other developed nations, we are getting the worst outcomes. So US is definitely an outlier. Here you see the performance, system performance, but you can also combine both of the graphics that I showed you. So here we see the system performance in one axis and the healthcare spending on the other axis. And US is definitely an outlier compared to other developed countries. So that seems really bad. We don't get the bang for the buck that we pay. And this is a sign of inefficiency. And while this may seem a little dark, actually, this is also an opportunity for improvements from another perspective. So if you are interested in making a difference in the most problematic part of the US system, which is healthcare, then you have your opportunity, because here we have this massive room for improvement, and this is actually a leadership opportunity. So beyond that, I want to talk about some of the trends also. I want to talk about margin pressure that affects healthcare organizations, AI revolution, cybersecurity issues that's affecting healthcare organizations, and the payer shifts and the turbulence that is created by these different trends that creates another leadership opportunity. So first of all, there's heavy margin pressure. So when I say margin pressure, I'm talking about the difference between what it costs to deliver care and what the healthcare providers are paid. So according to the Deloitte 2024 survey, healthcare CFO survey, about 25% of healthcare finance leaders reported that operating margins have fallen short of expectations over the past 3 years. And the worry of these CFOs are not the costs, so they can minimize the cost, but actually they cannot increase the revenue, which is more problematic and more challenging, because there's also ethical issues around increasing the revenue. Also, there are regulatory changes, like the political climate is very volatile, and that creates also regulatory changes around Medicare and also policy changes around the ACA. So that also keeps the volatility high moving forward. And beyond all of these, we also have this trend for the price transparency. Now, the US healthcare system is unique. It is not a publicly funded healthcare system. And most of the countries, especially developed countries in the world, are funded by the government. And we are totally different in that sense. But as an economist, I can say this, I guess, as a health economist, I can tell you that a system would perform, a free market would perform good, not perfect, but it could perform good when you have a solid price system. But we don't have that in the healthcare. We don't have that in many other countries too, but more specific to US, since we are heavily dependent on the private markets for healthcare, this is more crucial for us. And we don't see that price transparency, unfortunately. Now, there are several reasons for that. One reason is the third-party system that we have. But another reason is that the organizations are not very transparent, and let me say this, they are not honest about their prices. And this needs to change. And this is mentioned a lot in leader conferences, healthcare leader conferences, but the change is very slow. There are public policy changes also pushing towards more price transparency, but the change is happening very slowly. But eventually this is going to happen, but more price transparency also means more competition and more pressure on the margin. So that's another trend that is affecting healthcare organizations, healthcare providers nowadays. So what does that mean? That means we need policy literate leaders who can translate these policies and rules into strategy and budget and act strategically in this very volatile landscape. And that is the set of skills that you can gain with an MHSA degree, especially at Georgetown. Another trend is the AI revolution. Now, AI is not anymore just cool demos, but hospitals and health organizations are now started to use AI in different ways. And we also see some gains, especially in documentation, and in certain areas, also in outcomes, you see some gains. But these gains also need careful use of AI, especially in a secure way, being cognizant of the privacy of patients, and also being cognizant of the possible equity consequences. So we need some rules, or we need to have an understanding of the AI, but we need to use that in an ethical way. And I think our MHSA program is very strong in this sense. We have a very well-structured ethics course that is deeply rooted in Jesuit values, and that can help you guide for responsible use of AI. Also, the most important leadership roles moving forward are around CIO roles, Chief Information Officer roles, or Chief Digital Officer roles, or Operational Officer roles that needs to manage this change in a successful way, and also being cognizant of the ethical consequences. Cybersecurity is another very important trend that is affecting the healthcare organizations. I want to mention about this Change Healthcare cyber attack that happened back in 2024, February, March. So what happened was a general cyber attack towards healthcare providers. And according to an American Hospital Association survey, 94% of the hospitals experienced financial impact from this Change Healthcare cyber attack. And 80% of the hospitals also mentioned that the attack has affected their cash flow. So basically, cybersecurity is not just an issue that is affecting hospital cybersecurity, but also affecting the cash flow, affecting the finance, and affecting the healthcare access. So this is affecting a lot of individuals also. So this Change Healthcare cyber attack actually affects more than 192 million individuals. So this is also a major important trend that is shaping the healthcare landscape. Finally, I want to talk about another trend, workforce well-being. So especially after COVID, the mental well-being of the healthcare workforce became more and more important, because we have seen a lot of burnout, especially among nurses and other healthcare providers. So prioritizing the mental health and well-being of your patients on your workforce is also very important now. That is being emphasized more and more, because your workforce is basically what affects the performance of the healthcare organization, right? So it is not just employee happiness issue, but it is about quality of the healthcare that you provide. It's about access, and it can also affect the cost of healthcare that you deliver, because more turnover or more burnout workforce means actually a higher cost of healthcare. So we need more supportive, more resilient work environments. We need our leaders to be more, have a more human-centered approach, and lead their teams with ethical values. And I think our MHSA program is also very well versed in this sense. So talking about all these facts and trends, I think it's a very interesting time to be a healthcare leader, because you can make a change. And if you want to make a change where it really matters, I think healthcare is that field now in the United States. And if you can manage all these trends and sail your organization, lead your team, making a difference in this kind of environment where you can make a real impact, I think this is the time to invest in a healthcare leadership career. And we believe Georgetown MHSA is the right place for that. So that's why we are having this information session today.